to hit that like button and subscribe for more deep dives into the world of health and wellness. Today we're taking a closer look at a condition you might not have heard too much about, testicular torsion.
It's a serious medical emergency.
Yeah, it can affect males of all ages.
That's right. And while it might not be a common dinner table conversation, it's definitely something everyone should be aware of, especially if you have young men in your life.
Okay, so let's break down why we're doing this deep dive.
Yeah.
Testicular torsion happens when a testicle twists, cutting off its blood supply.
Mm-hmm.
We need to understand what causes this, how to recognize the signs, and why every second counts when it comes to treatment.
The thing is, this isn't just a theoretical risk.
All right.
Studies have shown that testicular torsion actually accounts for about 4.5% of all acute scrotal pain cases in the ER.
Wow, 4.5%. That's a lot higher than I would have guessed. So let's get into the nitty-gritty. What exactly causes a testicle to twist in the first place?
Well, picture the spermatic cord, the lifeline that carries blood to the testicle.
Okay.
In most cases, it's securely attached, but sometimes there's an anatomical variation called the bell clapper deformity.
Okay.
This means the testicle is more loosely attached within the scrotum, almost like a bell that can swing freely, making it much more prone to twisting.
So instead of being held snugly in place, it's more vulnerable to, let's say, getting tangled up.
Precisely. And that's when things can go south quickly. You see, when that cord twists, the blood supply to the testicle gets choked off, leading to ischemia. Essentially, a lack of oxygen reaching the tissues.
And that lack of oxygen is what causes the damage, right?
Exactly. Without that steady flow of oxygenated blood, the testicular tissue starts to die.
Right.
The longer this goes on, the greater the risk of permanent damage, and in some cases, the testicle might not be salvageable.
Okay, so we know it's a race against time, but what should people be looking out for? What are the red flags that scream, get to the ER now?
The most common and usually the most noticeable symptom is sudden, severe pain in the affected testicle.
Okay.
We're not talking about a mild ache. This is often described as excruciating pain. You might also see swelling, tenderness, and redness in the scrotum.
That makes sense. But you mentioned earlier that it can be tricky to diagnose. Why is that?
Well, sometimes the pain can radiate up to the abdomen.
Oh.
In some cases, abdominal pain is the only symptom, making it easy to misdiagnose as something else entirely.
So someone might think they have like a stomach bug or something like that, when in reality it's this urgent situation brewing, down below.
That's exactly the danger, and it's why awareness is so crucial.
Right.
We need to educate people to consider testicular torsion, especially in young men, even if the pain isn't directly in the scrotum.
So apart from pain, are there any other physical signs that someone should be aware of?
Absolutely. Pay attention to the position of the testicle. Is it higher than usual, retracted, or positioned horizontally? These can all be telltale signs that something's amiss.
Interesting. So we're looking for any kind of unusual asymmetry or change in position. Now, I remember reading about a specific reflex that doctors check. Can you tell us about that?
You're talking about the cremasteric reflex. It's a natural reflex where the testicle rises when the inner thigh is stroked. It's controlled by nerves that run along the spermatic cord. When that cord is twisted, the reflex is often absent on the affected side.
So it's like a built-in warning system that's malfunctioning when there's torsion?
That's a great way to put it.
Okay.
It's one of the key clinical signs doctors look for during a physical exam.
Okay.
However, it's important to remember that this reflex can be absent in some people naturally, and it's not foolproof.
Got it. It's a piece of the puzzle, but not the be-all and end-all. Okay, so let's say someone is experiencing some of these symptoms, or maybe they're just not sure. How urgent is it to actually seek medical attention?
Let me put it this way. Time is testicular tissue.
Oh, wow.
Within the first 6 hours, there's a very high chance of saving the testicle.
Okay.
But after 12 hours, those chances start to drop significantly. And after 24 hours, the damage can be irreversible.
Those are some sobering statistics. Suspect torsion. Don't wait. Don't try to tough it out. Get to the ER immediately.
I couldn't agree more. The faster you act, the better the chances of a positive outcome.
All right, so we know now that early detection is absolutely key. But once someone arrives at the hospital, what happens next? How do doctors actually diagnose testicular torsion?
Well, it usually starts with a thorough physical exam where the doctor will examine the scrotum and testicle, checking for things like swelling, tenderness, and the position of the testicle.
Okay.
They'll also test that cremasteric reflex we talked about.
And how reliable is that physical exam? Is it enough to make a definitive diagnosis?
In many cases, the physical exam findings are strongly suggestive of torsion, especially if the pain is severe and came on suddenly. However, to confirm the diagnosis and rule out other conditions, imaging studies are often necessary.
So what kind of imaging are we talking about?
The gold standard is a color Doppler ultrasound. It uses sound waves to create images of the blood flow within the scrotum.
Okay.
If the blood flow to the testicle is reduced or absent, it pretty much confirms the diagnosis.
So it's like a real-time look at the blood vessels to see if they're compromised.
Exactly. It's a powerful tool, but it's not without its limitations.
Okay.
In some cases, the ultrasound might not be definitive, or it might be delayed due to various factors. And in those situations, the doctor has to make a judgment call based on the clinical presentation.
So it's a balance between getting that visual confirmation and not wasting precious time if the symptoms are screaming torsion.
Exactly. And that's where clinical experience and judgment come into play. Sometimes even with a slightly unclear ultrasound, if the doctor is highly suspicious of torsion based on the history and physical exam, they might recommend surgery right away rather than waiting for more tests.
That makes sense.
Yeah.
It sounds like it's better to err on the side of caution in these situations. But let's talk about the treatment itself. What does the surgery for testicular torsion involve?
The goal of surgery is to untwist the spermatic cord and restore blood flow to the testicle. This procedure is called an orchiopexy. The surgeon will also typically fix the affected testicle to the scrotal wall to prevent it from twisting again in the future.
So they're essentially anchoring it in place to prevent repeat performance.
Exactly. And in many cases, they'll also fix the other testicle as a preventative measure.
Oh, wow.
Even if it hasn't twisted yet. This is because if one testicle has a tendency to twist, the other one might be at risk as well.
That's interesting. It seems like a proactive approach to address a potential future problem. So once the surgery is done, what does the recovery process look like?
Well, it varies depending on the individual, but typically there's a period of discomfort and swelling.
Okay.
Pain medication can help manage that. Most men can resume light activities within a few days, but it's important to avoid strenuous activities like heavy lifting or intense exercise for several weeks.
Okay, so gradual return to activity is key. Are there any specific things people should be aware of during that recovery period?
Absolutely. Keeping the surgical site clean and dry is crucial to prevent infection.
Okay.
It's also important to wear supportive underwear to help minimize swelling and discomfort.
Got it. Cleanliness, support, and patience seem to be the name of the game. But let's talk about the elephant in the room. A lot of men might be worried about the long-term implications of testicular torsion, particularly when it comes to fertility. Can you shed some light on that?
Of course. This is a common concern, and understandably so. Losing one testicle may affect fertility, but it doesn't automatically equal infertility.
Okay.
The remaining testicle is usually capable of producing enough sperm for conception.
That's reassuring to hear.
Yeah.
But are there any cases where fertility might be more significantly impacted?
Yes. If there's significant damage to the affected testicle, or if the torsion occurred at a very young age before puberty,
Right.
then there could be a greater impact on fertility.
Okay.
However, even in those cases, there are options available, such as sperm banking or assisted reproductive technologies.
So it's not necessarily a closed door, even in those more complex situations. But what about the psychological impact of this whole experience? It seems like it could be quite traumatic, especially for a young man.
You're absolutely right. Testicular torsion is not just a physical ordeal. It can take a toll on mental and emotional well-being as well.
Right.
Imagine the shock, the pain, the fear of losing a testicle. It can be incredibly stressful.
And then there's the worry about future fertility, even if it's not a certainty.
Exactly. It's important to address both the physical and psychological aspects of this condition. Open communication and support from family, friends, and healthcare providers are essential.
So we're not just treating the body, we're treating the whole person. This has been a truly enlightening deep dive so far. We've uncovered the urgency, the diagnostic challenges, and the importance of a holistic approach to treatment and recovery. We're not done yet. In our next segment, we're going to shift gears and explore some real-life stories that illustrate the human side of testicular torsion. Stay tuned.
As we delve deeper into this topic, I think it's essential to move beyond the medical jargon and statistics and really connect with the human experience of testicular torsion.
Absolutely. We've talked about the physical impact, the urgency of treatment, the potential long-term consequences, but what does this actually look like in someone's life?
Right.
What are the emotions, the challenges, the triumphs?
Well, I recall a case that really brought home the emotional roller coaster this condition can trigger.
Okay.
I had a patient, a young athlete, just 16 years old, who presented with classic symptoms, sudden onset of severe testicular pain, nausea, the works. We rushed him into surgery, and thankfully, we were able to save the testicle.
That's good news, at least from a medical standpoint.
Yes, but the psychological impact was profound.
Right.
He was understandably terrified during the whole ordeal. He was worried about his future fertility, about whether he'd be able to have children someday, and he was also grappling with the idea of having a surgery that, in his mind, felt very intimate and personal.
I imagine it would be especially difficult for, like, a teenager to process something like this. Did he have a strong support system to help him through it?
Fortunately, he did. His parents were incredibly supportive and understanding. They encouraged him to talk about his fears and anxieties, and they sought out counseling for him to help him cope with the emotional side of things.
It sounds like they really went above and beyond to make sure he felt supported, not just physically, but emotionally as well.
They did, and I think that made a world of difference in his recovery. You see, it's not just about fixing the physical problem, it's about addressing the psychological scars that can linger long after the surgery.
That's such a powerful point.
Yeah.
We often focus so much on the medical side of things that we forget about the very real emotional toll that conditions like this can take.
Exactly. And it's not just the patients themselves who are affected.
Right?
Parents, partners, siblings, they all go through it too. They experience the worry, the fear, the helplessness of seeing someone they love in pain.
So what can we do to better support those who are going through this? What are some practical steps that families and loved ones can take?
Communication is key.
Okay.
Create a safe space for open and honest conversations about what's happening, both physically and emotionally.
Okay.
Encourage them to express their fears, their concerns, their questions without judgment.
So really just listening, validating their feelings, and letting them know they're not alone in this.
Absolutely. And don't underestimate the power of simple gestures of care and support.
Right.
A hug, a listening ear, a home-cooked meal. These things can go a long way in providing comfort and reassurance during a difficult time.
And in cases where the emotional impact is more severe, seeking professional help is always an option, right?
Definitely. A therapist can provide coping mechanisms and strategies to deal with the anxiety, fear, and even potential trauma that can accompany this experience. They can also help patients navigate the complex emotions around body image and future fertility.
It sounds like having that extra layer of support can make a world of difference in helping someone process and heal from this.
Without a doubt. And let's not forget about the importance of awareness and education.
Right.
The more we talk about testicular torsion, the less stigma there will be and the more likely people are to seek help promptly.
That's a great point. By breaking the silence and normalizing these conversations, we can empower people to take control of their health and seek help without shame or embarrassment.
Exactly. And one of the most powerful ways to raise awareness is by sharing real-life stories. Stories like the one I shared about my young patient, they remind us that this is not just a medical condition, it's a human experience with real emotions, challenges, and ultimately resilience.
I completely agree. Those personal narratives can really help us connect with the issue on a deeper level and understand the importance of early detection, swift action, and comprehensive support.
And as we wrap up this segment, I think it's crucial to reiterate that while testicular torsion is a serious condition, it's often treatable, especially if caught early. Knowledge, awareness, and timely intervention are key to ensuring the best possible outcomes.
Well said. Now, in our final segment, let's delve into some practical strategies for raising awareness in our communities. How can we spread the word, break down the stigma, and empower people to take charge of their health? Stay tuned. So we've covered a lot of ground in this deep dive. The medical urgency, the emotional impact, the importance of support. Now let's kind of shift gears and think about action. How can we as individuals and as a community raise awareness about testicular torsion?
Yeah, that's the million-dollar question, isn't it? And I think it starts with education. We need to reach young men, parents, educators, coaches, anyone who interacts with young men, and equip them with the knowledge to recognize the signs and act quickly.
So where do we begin? Are we talking about like pamphlets in doctors' offices, health classes in schools?
Those are definitely good starting points.
Right.
But we can get even more creative.
Okay.
Think about leveraging social media.
Right.
You know, we're in the age of information, and platforms like TikTok, Instagram, and YouTube can be incredibly powerful tools for reaching a wide audience.
I see where you're going with this. Imagine short, engaging videos explaining the symptoms, the urgency, the importance of seeking help.
Mm-hmm.
We can even partner with, influencers, athletes, celebrities to help amplify the message.
Exactly. Make it relatable, make it shareable, make it go viral. We need to break through the noise and make testicular torsion a topic that people are comfortable talking about.
And it doesn't have to be like all serious and doom and gloom either.
Right.
We can use humor, animation, personal stories, whatever it takes
Yeah.
to grab people's attention and make them remember the key messages.
I love that. And while we're at it, let's not forget about traditional media. We can write articles, pitch stories to local news outlets, reach out to health and wellness publications. The more we talk about it, the more normalized it becomes.
It's about breaking down those barriers of silence and making sure that young men feel empowered to speak up if they're experiencing any unusual symptoms.
Absolutely. And it's not just about reaching the younger generation. We need to educate parents, guardians, and educators as well. They play a vital role in recognizing potential signs and advocating for their children's health.
So it's a multi-pronged approach, targeting young men directly, empowering those around them, and utilizing all available channels to spread the word.
And let's not forget the power of community involvement. We can organize awareness events, partner with local health organizations, even create educational materials to distribute in schools and community centers.
It's about making this a collective effort. We all have a role to play in breaking down the stigma, promoting early detection, and ensuring that young men get the timely treatment they need.
Well said. And as we wrap up this deep dive, I want to leave our listeners with this thought. Knowledge is power. The more we know about testicular torsion, the better equipped we are to protect ourselves and our loved ones.
So let's take this knowledge and turn it into action. Talk to your sons, your brothers, your friends. Share this information, break the silence, and help make a difference in someone's life. Thanks for joining us for this deep dive into testicular torsion. And be sure to subscribe to HealthyCast for more deep dives into the world of health and